Hello, everyone. Welcome. This meeting was called in regards to the hepatitis C rampage that we all know that is going on in our community. I would like to address our workers, the individuals that we know that are susceptible or at risk of getting infected from this hepatitis C. I'm talking about our community health workers, the investigators, our district nurses and physicians, our social workers, as well as our phlebotomists. We know that hepatitis C is a liver infection that is caused by hepatitis C virus, although it can be a short-term infection. However, half of the hepatitis C infection also becomes a long-term or chronic infection. And according to the CDC, we have the data that the incident rate from 2013 has been doubled. I have here a graph that shows us the prevalence rate also, how hepatitis C infection is being increased. So the risk factors I want us to know and put in mind is includes unsafe injection practices, reusing of needles, improper handling of finger stick devices. When we take blood, when we collect samples from any individuals, improper handling of these finger stick devices and the syringes and other lapses in infection control can make us be at risk of being infected. So here we know we have a lab on the third floor. So please, whenever you go out there or you come in contact with any patient and you are poked with needles, please go straight to the third floor. That's where you are going to get tested. And let's follow the CDC guidelines. 48 hours after exposure, we have to have a baseline testing for anti-HCV, that is hepatitis C virus. And then another testing will be done in 3 to 6 weeks post-exposure. After that, we come back for testing within 4 to 6 months. So I want us to also bear in mind the window period for this infection before the detection of antibodies. The average is 8 to 11 weeks, with a reported range of 2 weeks to 6 months. Why is it so important? This meeting is called because our staffs, you go out in promoting it through investigation, we do research, and we do awareness, we raise awareness in regards to this infection and the transmission of this disease. So it's important also that we are protected against any means of exposure. I know sometimes we go to the homeless, we go, to talk to them. We see people at the park also, at the playgrounds. So as patients and the community are being cancelled on the means of transmission, such as blood to blood, sharing of drug injection equipment, and usage of needles. It is also important also for us as staffs to be aware of our surroundings. So we need to avoid stepping on needles, don't just put your hands anywhere when you go out there on the field, and you need to ensure that you are following the proper protocol of needle disposal. Now I'm talking to our nurses and our phlebotomists, excuse me, and making sure that we wear our gloves properly also. Please, let's think safety first, arrive to work safely. Let us make our workplaces a safe place to work also, so that we can get back home safely to our family. We care about you. Thank you.